Are bow tie questions tripping you up on the NCLEX-RN? You're not the only one. In this video, I'm going to show you how to break them down step by step so you can walk into the exam confident and prepared. This is video 1 of our 10-part series on next generation NCLEX question types. If you're taking the NCLEX in 2025, stick with us. You won't want to miss a single video. Quick disclaimer, this video is for educational purposes only. It does not guarantee a passing score or licensure. Always follow your school's guidelines and your state board's official requirements. This channel is not a replacement for nursing school. Bow tie questions test your ability to make clinical decisions using critical thinking and layered judgment. The structure always looks like this. In the middle, you select one potential condition the patient is experiencing. On the left, you select 2 actions to take based on that condition. On the right, you choose 2 parameters to monitor so you can evaluate the patient's response. Think of this as a nursing detective mission. You're given a detailed patient case, and you have to look for clues in the symptoms, vital signs, and lab values to figure out 1. What's going wrong? 2. What should I do? 3. And how do I know it's working? Here's a simple 4-step strategy to help you solve bow tie questions like a pro. Read the entire case, don't rush. Look at the patient's history, current symptoms, and any labs. Identify clinical clues. What stands out? Is anything abnormal, trending, or urgent? Pick the most likely condition. Place this in the middle of the bow tie. Select interventions and monitoring. Choose 2 nursing actions on the left and 2 things you'll watch for on the right. Let's go through a few practice questions together. Still watching? Great, because this is where it all starts to click. Let's practice together so you'll feel ready when this shows up on your NCLEX. A 73-year-old male with a history of congestive heart failure presents with shortness of breath, bilateral crackles in the lungs, and 3+ pitting edema in the lower extremities. Vital signs: BP is 158/92, respiratory rate is 24 breaths per minute, SpO2 is 89% on room air. Here, your clues are shortness of breath, crackles, and edema, all signs of fluid overload. The right actions help remove fluid and improve breathing, while the parameters show whether your interventions are working. The correct answer: condition in the middle, fluid overload. Actions on the left: administer furosemide and elevate head of bed. Parameters on the right: respiratory rate and oxygen saturation. Practice question number 2. A 45-year-old woman with type 1 diabetes is found confused and diaphoretic. Blood glucose, 42 milligrams per deciliter. This patient is having a hypoglycemic episode. Your job as the nurse is to act quickly, treat it, and then monitor for improvement. The clues in the case: confusion, sweating, and low glucose lead you straight to the right condition. The correct response: condition in the middle, hypoglycemia. Actions on the left: administer 15 grams of oral glucose and recheck glucose in 15 minutes. Parameters on the right: monitor level of consciousness and blood glucose level. Next question. A 62-year-old male is 1 day post-op from abdominal surgery. He reports increasing abdominal pain. His abdomen is firm, distended, and bowel sounds are absent. He has not passed gas or had a bowel movement since surgery. A rigid abdomen and no bowel sounds after surgery should make you think of ileus. You act by resting the gut, decompressing, and monitor signs for signs of improvement. The correct answer here is a condition of paralytic ileus in the middle column. On the left, keep patient NPO and insert NG tube. On the right, monitor abdominal girth and bowel sounds. Let's review. In bow tie questions, the nurse plays the role of a clinical detective. You'll find clues, determine the condition, take action, and monitor outcomes. The format is always the same for each: condition in the middle, actions on the left, parameters to monitor on the right. Practice these often. They're showing up more and more on the NCLEX. And don't forget, next week we're covering drag-and-drop questions. You'll learn how to answer ordered response, close, and rationale sorting questions. Subscribe and turn on notifications so you don't miss it, and I'll see you in the next video.